All right, is this any better? Can you guys hear me? Okay, there we go. All right, so we'll keep that moving. So with that, we've got some training that's happening across this week, and I'm going to go ahead and share my screen with everyone and ensure that you guys can get into the training. And here we go. All right. So this week, there's lots of virtual trainings, but I do want to keep you guys posted that, we are in lock-in now, and for Medicare and ACA, you're really needing to understand how to search and destroy for SEPs, okay? So the first thing is do you understand how to work with DSNPs? There's a training Humana's putting on this morning at 11. There's a playbook that you can access. It's got all the secrets, tips, and tricks that you can use to market to DSNPs. So that's provided by Humana. There it is at 11 o'clock. You can move on over later today. United Healthcare is doing virtual office sessions. You can call in and get your questions answered for anything United Healthcare related. That's today at 4 o'clock. They're also doing another one at 3 o'clock. And a special session on Thursday at 2 o'clock for the redetermination specifically for Medicaid. So if you're interested in learning more about the redetermination, remember we sent you guys out a video and a training guide. But if you still need a little bit more TLC on that, please make sure you attend these sessions as the carriers are providing them to you. So that's at 2 o'clock on Thursday for United doing that. Moving over to tomorrow, Tuesday the 18th. Hallelujah, it's tax day, right? So those of you that are looking for a refund, tomorrow's the deadline to get that done. But there are a couple of training sessions. Cigna's doing their virtual office session tomorrow at 9, and another session on the 19th, which is Wednesday at 12:30. So again, call in for any questions that you have for Cigna. Devoted's doing an open training session at 11. So if you're new to Devoted or you need a little bit of TLC with Devoted, that's tomorrow at 11. Moving over to Wednesday, we've got our very own Al Clancy, who's doing a virtual coffee and chat. That means bring your own coffee. Sorry, he's not providing that to you via the internet. So, but definitely jump on there if you have any questions, concerns with anything health plan markets related across all carriers, across all providers. We're just here to help you. Al's going to be available at 9:30 on Wednesday for anyone that wants to jump on that. Thursday, MedSup training. We've got a lot of interest in MedSups. Lots of questions regarding MedSups. So Thursday at 10 o'clock, United Healthcare is doing a deep dive session. If you are interested or if you're working with MedSups, this might be a great opportunity for you to jump into that training and get a little bit more TLC on that. Also on Thursday at 11:30, you've got Devoted doing their coffee and chat sessions. So that's new. Humana is doing a new agent training on Thursday at 12. So if you're new to Humana, or if you haven't sold it in a while, they're doing their training at noon on Thursday. And that's pretty much the training for the week. Again, guys, you got to keep one foot in the classroom and the other one in the field. Pick one training this week. If you didn't go to a training last week, double down this week, because this is training season. This is how you're going to get your chops up to be better as an agent and to improve your technique, understanding of strategies, and all that good stuff, okay? So please make sure that you spend some time getting your knowledge right. Okay, switching gears here, CMS has put out the brand new Medicare Communications and Marketing Guidelines. This was finalized on February 9th and was launched to us last month. And so there's been some significant changes to the guidelines for marketing. And I want to go through those guidelines because these are things that are going to be coming into place for 2024, if not sooner. Okay, so definitely for 2024, but maybe even sooner. These are proposed changes. These are finalized and waiting for final approval. And you can find these guidelines on the CMS website. And so I'm going to go back here and you should be able to see it here. So if you go to CMS, I'm going to pop the link into the chat here so everyone can access that. But there it is. So you can actually go there and it's the first link on the downloads of Medicare Communication and Marketing Guidelines. It's a doozy. Let's see how many pages are on this bad boy. You've got Well, it says 51, but we know that's not true. I think the last time I looked, it was 172 pages. So obviously we're not going to go through 172 pages this morning, but I do want to point out a couple of key changes that are happening in the marketing guidelines for us to be aware of and to prepare for. The first one is there will be no marketing events at the same location within 12 hours of an educational event. So if you're setting up Medicare 101s, you can't turn around and turn it into a sales presentation directly afterwards. That's a strategy that some agents were doing. So they would, do a Medicare 101 and then, hey, if you stick around, I'm going to be talking about X plan. You can't do that anymore. You got to wait 12 hours after an educational event, which basically means the next business day, right? There will be limited use of the Medicare name, logo, and Medicare card coming on marketing materials. So this may come where advertisements will no longer be able to actually use the Medicare card on it, or even the Medicare logo or their name. You can't even say Medicare. So that's kind of crazy to think about. Not sure how that one's going to pan out. Marketing plan benefits in an area where benefits are not available are prohibited. So this kind of is focusing on TV advertisements that bleed into other counties that maybe the plan is not specifically in, or the benefits of the plans change in that county and they're advertising it. So for instance, we're here in Central Florida, Greater Orlando area has richer benefits in the city, Orange, Osceola, Seminole County, than if you go out into Volusia or Flagler or something like that, where you don't have the same benefits. But unfortunately, the TV advertisements are launching in those counties too. It doesn't sync exactly the same. So you have to be very careful. What's happening now is CMS is getting a lot of complaints saying, hey, I saw a TV ad. They said that I can get these benefits and I can't because they're not in my county. So they look at that as false advertisement in a way. So that's going to be changing. Okay. Marketing information that revolves around savings, specifically when in regards to the comparison of typical expenses for uninsured individuals, unpaid costs for dually eligible beneficiaries, or other unrealized costs of a Medicare beneficiary. So Medicare is trying to go away from comparing a plan against someone that's uninsured or dual eligible that doesn't have a plan, or other unrealized costs. So things like, a 20-day hospital stay is an unrealized cost because that's very specific, right? So the marketing information is going to be changing around those advertisements. The collection of scope of appointment cards at educational events will now be prohibited. So as of today, if you did an educational event, if you did a Medicare 101, you can collect a scope of appointment there today. You can do that today. In the new rules, they're saying you're not going to be able to do that. Okay, so you can collect consent to contact, which is fine, and you guys should know how to do that with your Spark platform. But now you cannot collect a scope of appointment. Okay. And then the last one here, big one here, it says words like most or best when referring to Medicare assistance are prohibited in marketing materials, unless providing data from the previous year to support that statement. Still some gray area with that, parentheses that they've got going on. But they're not going to be able to say, best Medicare Advantage plan or, most benefits in a, county unless they can actually prove it. Okay. So CMS is getting a little bit, tighter with the restrictions. I think they loosened it up quite a bit in years past, but new leadership there at CMS is saying, no, we need to tighten this up because we're getting a lot of complaints from the seniors. Okay. Now it says that the final ruling of the Medicare Advantage plan will go into effect June 5th of 2023 and are applicable to coverage beginning January 1st, 2024. Again, this hasn't been finally approved or in effect until June 15th, so they could change a few things. They could make some adjustments until then. We're keeping a note on that, but those are the suspected changes that are happening at CMS with Medicare that are coming down the pike. So just be prepared. Some of this may not affect you at all in what you do. The other question is, hey, Justin, are they getting rid of call recording? No, they are not getting rid of call recording. That is still a thing. It's going to continue to be a thing. So I know some of you are going out and still seeing your people face to face. That's fine. But the most efficient and effective way to do your business these days is on the telephone, right? You can, with the technology that you guys have, that we have supplied with you, you have the ability to enroll anyone in virtually any plan anywhere that they live. And we're going to talk a little bit about that today because we have a special guest on the line, Miss Anne-Marie Chapman from HealthFirst in our beautiful state of Florida. And she's here to talk to you about HealthFirst and all the great things that are happening. And I'm going to let her announce the very fun and special thing that we've got going on specifically to our enrollment software that's happening with HealthFirst. And there it is. So Miss Anne-Marie, if you'd like to introduce yourself.
Great. Thank you, Justin. Yes.
You're welcome.
Latoya is on the line as well. So
great.
I think I don't want to steal Latoya's thunder. She's the one that did the heavy lift on all of that. So we'll talk a little bit about, can I share my screen, Justin? Is that okay?
Yeah, you should be able to do that.
Okay. Let me try that.
There it is.
Okay, great. Let's see, slideshow from the beginning. Okay, there we go. Or not. Let's see what's happening here. Oh, technology is a wonderful thing.
Oh, it's fun, isn't it?
Right,
I've already had my bloopers this morning, so take your time.
I know. Technology on a Monday morning, especially. All right, let me try this.
And while Anne-Marie's getting set up, guys, I just want to point out that HealthFirst is a very important partner with us, specifically in the Florida market. Not to be confused with HealthFirst in New York. There is a different HealthFirst in New York. This is HealthFirst Florida. So if you do business in Florida, pay attention. There's some big changes that happen to HealthFirst. So you're on, Anne-Marie, and we can see your beautiful slide deck. We're good to go.
Yay! Okay, great. Thank you so much. Yes. So thank you so much, Justin, for letting us be here this morning. I wanted to introduce or reintroduce HealthFirst Health Plans. We are here. We are local. We are a small health plan, but we are growing. And so we just wanted to come back and say hello and give you a little bit of overview of who we are and where we are. And okay, so let's get into it. So we are a health plan located in Brevard County, Florida. The health plan was formed in August of 1995. We're an integrated delivery network. So we are a network that combines, we're not for profit, and we combine health insurance, hospitals, doctors. We are the Space Coast's largest multi-specialty physician group that serves our community. Our membership right now, it's probably closer to about 65,000, a little bit more in Medicare Advantage than individual. And we have over 4,000 providers across Central Florida. So we are, like I said, we are small, we're growing, and we're happy to be here. So I'll talk about the individual plans, and then we can let Latoya talk about the Medicare Advantage. In 2013, we launched the individual plans in Brevard and Indian River counties. And in 2014, we expanded, just as the ACA was dawning with individual plans, we expanded into Volusia and Flagler through a partnership with Advent Health. And the name of the plan, you may have heard at the time, was Advent Health Advantage Plans. As of 2022, all 5 counties are adopting the name HealthFirst. It got a little confusing. Is it Advent Health? Is it HealthFirst? And we had a little partnership with Oscar last year that we no longer have, so it really became confusing. So we are streamlining our name, our brand, so we are going forward as HealthFirst Health Plans. We still have that partnership with Advent Health. It remains strong. As a matter of fact, Advent Health actually owns 25% of the HealthFirst system. And today we have over 30,000 individual members in the 5 counties that we're in. So very quick overview of the coverage area. Right now, we can enroll members in Brevard, Indian River, Volusia, Flagler, and Seminole. Our members have access to providers in all of those areas, as well as Orange and Osceola. We are an open access HMO plan. So our members do not need a referral from the primary care physician. They just need to use an in-network provider. And again, our network is primarily HealthFirst and Advent Health providers and facilities across Central Florida. And I will say that we've talked about this in previous years, but I'm pretty sure we're going to do it this year. We will be expanding into Orange and Osceola counties and a couple of other counties as well. So stay tuned for that. As far as our plans go, we have very competitive this year. We have value plans in Brevard County that have a tiered network. So our members who are using the HealthFirst facilities and doctors in Brevard County will actually see a cost savings when they use HealthFirst providers. We also introduced a zero medical deductible bronze plan this year that has become very popular very quickly. Our prices are great. We are on the first page for all of our plans in all of our counties. So we're very happy to be here and to be very competitive. Okay, so with that, I think I'm going to let Latoya unmute and speak to the Medicare Advantage plans.
Thank you, Anne Marie. Good morning, everybody. My name is Latoya Bogner-Jones, and I'm the broker sales liaison for Medicare. And I'm just going to touch a little bit on our 2023 Medicare Advantage plans that we offer. If we go to the next slide, please. All right. So one of our top selling points is that we are locally owned and operated. Our corporate office for HealthFirst is right in Rockledge, Florida. So our members have the ability to come right into our corporate facility and speak with customer service face to face. You can walk in our lobby from 8 to 5, Monday through Friday. Our customer service is available from 8 to 8 p.m. and 8 to noon on Saturdays. And then October 1st to March 31st, we're open 7 days a week from 8 to 8 p.m. So we offer that as a flagship here in Brevard County, just being able for our members to access us. And my contact number I'll give out at the end as well for everyone. We'll make that contact number available for both of us. The next slide, Anne Marie, please. Sure. We own and operate 4 hospitals in Brevard County as well. Our Cape Canaveral, Holmes, Palm Bay, and Vieira Hospital. 2 of our facilities are 5-star facilities, and the other 2 are 4-star facilities. With our HealthFirst Medicare Advantage plan, these 4 facilities are in network to all of our members on our plan only. All of the other Medicare Advantage plans uses a different hospital systems. So one of our major selling points for Medicare Advantage here in Brevard County is our exclusivity. You can only have access to these 4 hospitals with the HealthFirst Advantage plan, as well as our HealthFirst Medical Group, which is the largest multi-specialty medical group in all of Space Coast. We also offer the extended Advent Health Network, just like our individual plans. Our members on our Medicare Advantage plans have access to a number of hospital facilities through our Advent Health partnership, as well as 4,000 physicians throughout our Medicare Advantage network. No referrals are required to see specialists on any of our plans. That's another one of our top selling points with our HealthFirst Medicare Advantage plans. We're considered an open access plan. We're not a gatekeeper plan. You don't need to get permission from the plan to see a specialist. We have 4 plans that we offer in Brevard and Indian River County. Our classic plan, which is our HMO plan with a point of service benefit. A lot of people think that just because we're a local plan, you only have access to local care. All of our plans offer worldwide coverage for emergency care and urgent care. And our classic plan gives you the ability to use our in-network physicians, as well as using a point of service benefit go out of network. We have our value plan. Our rewards plan is our $0 premium plan. And then we have a plan called our secure plan that's MA only. So if you have someone maybe that's with the VA or have another form of credible coverage for prescription drugs, our secure plan is a $0 plan with rich benefits for Medicare Advantage only. In Hardy, Highlands, Flagler, and Volusia County, we have our Sunsaver HMO plan, also a $0 plan, and no referrals are required to see specialists, again, on any of our Medicare Advantage plans. Our low-cost benefits that are included on all of our plans, we have more than 150 prescription drugs that we offer at a $0 copay. These are lots of your diabetic, heart medication, cholesterol, high blood pressure on our Medicare Advantage prescription drug plans. We talked about no referrals being required, more than 4,000 providers, worldwide coverage for emergency care and urgent care. And all of our plans have a routine dental benefit that gives you $1,000 to see any dental provider on our Liberty Dental Network, and an additional $250 dental debit card that allows you to go to any dentist for dental services. We have vision at $400 towards our dental hardware. Vision hardware, and a $0 vision copay for routine dental vision exam on all of our plans. We have our hearing benefits. We offer over-the-counter benefits, wellness rewards, and non-emergency transportation. And then we offer a $0 gym benefit through our Silver and Fit network as well. Before we get into upcoming events, I just want to add a note that says that prior to today, you had to enroll into our Medicare Advantage plans through our separate connector platform. But I'm excited to announce that going forward, we will be integrated into your health plan markets enrollment platform, and you'll be able to enroll direct into HealthFirst health plans from your health plan markets enrollment platform.
Outstanding. You don't know how long we've been waiting for that. We are very, very excited about that. So that's Medicare Shop, guys. That's our quote and enroll tool, Medicare Shop. We are waiting for the final sync from Connecture. So as soon as that launches, we'll send you guys out an email saying, hey, it's live. Just remember, though, it's not going to show up to enroll unless you are ready to sell. You must be ready to sell with HealthFirst. If you don't have a HealthFirst contract, please reach out to contracting@askhpm.com. We'll get you set up there, and then we'll go ahead and sync it into Medicare Shop so you have access to it. Sorry, Latoya, just had to say that.
Oh no, I
There
wanted you to jump in on that. We're really excited about that.
Yeah.
I did see a question I just want to answer real quick. Someone asked if HealthFirst will accept Humana PPO. Anyone that has a PPO plan, you can use out-of-network facilities on that PPO. The members will accrue a higher cost. So for instance, with one of the Humana PPOs, if they did want to go to a HealthFirst hospital or doctor, they're going to pay 50% of the cost for the entire procedure or for the office visit. So because of that higher price point, lots of members would, rather take the route of having HealthFirst as an in-network facility. If you get hospitalized or you go to see a specialist and get a procedure, that 50% could eat up lots of the other benefits that they're receiving on that plan.
Yeah, and just 2 notes on that. The first note is they're referring to the HealthFirst medical service, the network itself. So HealthFirst is a hospital and a care coordination network with providers as well. So that's what that question was referring to, not the health plan specifically, because those are two, HealthFirst, the health plan, is a competitor of Humana PPO. Now,
yeah.
what you learned today, and what you learned today, guys, is that their HMO does not require referrals. So why would a Humana PPO member try to access HealthFirst? They don't want referrals. We get that. So in order for them to have a better experience and a seamless experience, maybe those Humana PPO members might be better off in a HealthFirst plan. So really think about that. Look at your book of business. Sorry, Latoya. I get so fired up when you guys are on. So there you go.
I love it. Thank you.
You got it.
We did have some upcoming events that we had, that slide that we were going to go over, just so that you all know. We're going to be doing some, we call them lunch and learns. We're not providing lunch over the over the internet. They will be virtual things, but we will be raffling off gift cards to either Panera or Jersey Mike's or something like that. So somebody may actually get lunch out of the lunch and learn, but those will be coming up in May. We want to invite our brokers in to learn more about things like how we do prescription drugs, how our formulary is determined, how our medical management people help our members, what to do if somebody needs care that has to be medically managed. How do we do that? So giving you all of that type of information and letting you know us better, I think will be able to allow you to help your clients better and answer the questions. So, and that's it. Thank you.
Awesome. Just a couple questions here, on behalf of the team. I know, and thank you for describing the relationship between Advent Health, because there's been a lot of rumors around that. And thank you for clarifying that, yes, Advent Health does have a stake in HealthFirst, which, guys, if you ask me, no other hospital system has a similar setup like this. So knowing that you're setting your members up with a health plan that is synced deep with the hospital and provider network is something you really should consider, because there is a lot of volatility in our industry where a plan drops a doctor, a doctor drops a plan, a hospital drops a plan, a provider network gets sold. There's a lot of that happening in this industry right now, and knowing that your members are secure with a health plan, and that health plan is specifically also owning the network as well, is something to really, really consider about the longevity of your book of business. Okay, we all know that we are part of customer service, and the last thing that you want to do is go out and have to flip your members because the doctor, the hospital, and the plan were at ends meet with each other, and now bada bing, you got to go move 100 members, 200 members of your book of business because they didn't get along, right? So think about that for longevity, right? But here comes the question. I know, and this is pointed for Anne Marie, the relationship with Oscar, Advent Health. I know they were helping with the infrastructure there. I know you kind of went away from it, and then there's rumors that you're bringing them back. Is that Oscar relationship still there? Because we still see some of that lingering in our broker portals and all that. So can you kind of explain, I guess, the future of that relationship?
Sure. So there is no future in that relationship. So again, we're a small health plan and we are growing rapidly. And one of the things that we have had a hard time bringing up to date was technology. So in 2022, we entered a partnership with Plus Oscar, which is a technological side of Oscar Health Plans. So we entered that relationship with them, and it didn't work out. There were a lot of reasons why, but at the end, I guess I can sum it up by saying the level of service to our customers and our brokers was not high enough for us to be comfortable with that relationship moving forward. So we have always prided ourselves on the level of service that we provide both to our brokers and our customers. There were some claims issues that are still being unwound as well, and therefore that relationship has ceased. If you're seeing anything about Oscar on the broker portal, you might be in the wrong place. So make sure you go to myhfhp.org/brokers, or you can click on brokers once you're there. I did put Latoya and my contact information up on the screen. I hope you grabbed that. I'm sure that Health Plan Markets can make that available as well. And Latoya and I are here. We are in Central Florida. We are here to help. You can call us, and we are happy to answer questions and help you navigate any of that. But to answer the question, no, the relationship with Oscar has ended, and there's no future there.
Awesome. Thank you for clarifying that. This one might be for Latoya. We had a plan, Bright Health, that came in and had a relationship with Advent Health that was supposed to be very similar to the HealthFirst experience with an exclusive networking contract. But we later learned that Advent Health had a sub-network or secondary network inside of its own network that unfortunately wasn't syncing with the Bright Health plan. And so there was a lot of clients that were promised that they would be able to access the Advent Health network on the Medicare side, but then come to find out that a lot of those providers in their sub-network were not contracted for that particular product. So I was wondering, does that still exist in the HealthFirst universe, or is that something specific because that was an external health plan?
I'm not sure what agreement they had with Bright Health, but with our partnership with HealthFirst, our extension goes throughout Central Florida, and we list not only the hospitals that are included, but we list all of the providers that are included as well in our provider directory. And so in total, there are 17 facilities, Advent Health facilities in the counties all across Central Florida, which goes as far all the way over towards Orange, Osceola, Volusia, Flagler, Hardy, Highlands. Let me see, as far up as, I don't have it in front of me, but I can send that listing out to you. Actually, we have a slide, Anne-Marie, on the presentation. Yeah, I'm trying to name them all by heart. There are 17 total facilities.
You're doing good, though. Better than I could. We list them all out so that our members are aware exactly what providers and exactly what facilities are included as a part of our network. And we'll put that up on the screen just in case someone wants to screenshot it or save it. We have that available.
Yeah, and Justin, I want to piggyback on that as well. Because over the last couple of years, there was a lot of confusion with the providers, with the members, and even the providers were confused. If any of your agents run into any confusion with any of the providers, Latoya and I are able to troubleshoot that with our provider operations department. So sometimes it's a matter of provider education. So we can get our engagement team to reach out to them, or it could be, some confusion on some other part. But I just want to let you know that we have the ability to troubleshoot those types of issues.
Awesome. And then here's a question in the chat here too. It says, is the new hospital still moving forward on Merritt Island?
So yes, the hospital is moving forward. There were grand plans for an entire wellness village, and I believe the wellness village is either not happening or on hold. Actually, at 9:00 this morning, there was a town hall meeting at HealthFirst that
Uh-oh.
that Latoya and I are not attending this morning.
So
But
sorry.
yeah, that's okay. But yes, the hospital will still be happening on Merritt Island. Yes.
Outstanding. Outstanding. Thank you guys for sticking around. We had a couple of extra questions here, and we appreciate your extra time with us, Latoya and Anne Marie. We really appreciate you co-hosting this morning and giving us an update on HealthFirst. By the way, I am such a big fan of the new branding. It's so clean and fresh and millennial. You know, you guys are getting us. Yeah. No, but I love it. The new website is a lot easier to navigate. You guys showed up in your purple sneakers on Friday. I mean, you guys got your stuff together. It's amazing.
It took us a little while, but we're getting there. We're getting there, Justin.
Oh, I love it. I love it.
Thanks.
Outstanding. Well, thank you all for being on the call this morning. As a reminder, these calls are being recorded, so you'll find this on YouTube here later this week. Anne Marie, Latoya, if you need a copy of that, we're happy to send you a copy as well to prove that you were working this morning and not on the beach during your town hall meeting. So I got your back. You're good. You're good with me.
Thanks, Justin. Thank you.
You're welcome. Thank you guys very much. We will see you next week on Monday. Have a fantastic, safe, and productive week, and go out and help your fellow neighbors. Thank you guys. Have a great day.
Thank you.